we make hormones, estrogen, from the little follicles developing in our ovaries. The follicle then becomes an egg. So the first half of our period or the cycle, so which is from the menstrual bleed until we ovulate, is called the follicular phase, because these little follicles are developing and they're producing estrogen only. Then we ovulate at around day 14, 15 of the cycle, and then estrogen levels go back down. So estrogen is our main female hormone. Then after we ovulate, there's this little patch in the ovary called the corpus luteum, which is where the egg had been, and that produces progesterone, which is the other hormone. We produce progesterone because that's really required for that pregnancy to occur. So you ovulate, then you get the progesterone because you need progesterone for the embryo to implant. That means that it's completely normal to not have progesterone in your first half of the cycle. Well, you can't. You only produce progesterone in the second half. So that progesterone is probably what's related to some of those, not as good feelings in that second part of our cycle and PMS. Hormones can impact our neurochemistry and, how our body regulates serotonin, dopamine. Progesterone increases our core body temperature by about 0.3 or 0.6 of a degree. They've done studies where, people in the luteal phase, that second half, their performance isn't impacted in normal temperature, but put them in 30-degree temperature. They don't perform as well because of that core body temperature. Also, progesterone can make you a bit constipated, also makes you hungry. So there's, changes that we see at different parts of the cycle. And when we know them, we can either one, change our training to the cycle if we find that helps us, or two, like you say, just have a bit of compassion for yourself. But, I'm feeling tired. I'm not going to push so hard. And there's reasons why I feel tired. And I think, that's part of this burnout culture, like sleep when you're dead. There's no excuses, all of that. I think that's absolute bullshit. That means we're not listening to our bodies and we can't perform well if we're not recovering. It's interesting as a doctor because sometimes people come into my room and I give them all this lifestyle advice and then they're like, oh, so that's what you're going to do. But then we hear, I've spent, how much money and you're just telling me to go to bed earlier and exercise more. But then we hear people, grumpy because all doctors ever do is prescribe tablets.
Yeah.
I think this answer has two prongs. One, we doctors definitely need to do more lifestyle things. But the current system of care is not supporting that at all. How can doctors be expected to examine someone, get a history, diagnose them, and get management and, talk about all of their lifestyle in a 15-minute appointment? Yeah. It's ridiculous. I'm very pro non-bulk billing doctors. I wish that wasn't the case, but I think realistically the current system is if you're going to see a doctor and do that really holistic, you need to see the same doctor regularly, and probably you might have to pay a gap because doctors cannot make any money because they're working privately and paying the reception staff everything if they're bulk billing everyone. And I wish it wasn't like that, but that is the reality. So I think there's issues in the healthcare system that doctors don't focus enough on lifestyle. Also, I think doctors sometimes they're not that lifestyle focused themselves. If you don't like exercise, you're probably not going to prescribe it. And I'm actually doing a study at the moment. I'm looking at barriers to why doctors don't prescribe exercise more. I'll let you know when it's published.
Yeah, please.
So I think that's part of it. But then, and I think doctors sometimes do probably, prescribe things and not go into lifestyle more. But then the other thing is, and it goes back to what I said, people are wanting self-gratification. They're wanting to be an expert without any proper qualification. So how can they be an expert when they're not? It's going to be to focus on, supplemental, like everything that, an actual doctor can't do. No, everything a doctor, they can't do what a doctor does, which is prescribe tablets. So they're smearing prescribing tablets because, that supports their agenda.